I'm going to give you this highest part of this adjustable pillow first, and you'll notice that the height is like really high here, a little lower on that edge.
Right.
This is because of that tilt in your head.
Okay.
Okay. So let's put that under there first, and let your body just relax.
Mm-hmm. Okay.
Good. Okay, now your eyes are blinking, right? So, and it isn't really an eased position for you yet. Your head is actually a little lower than level still. It's not at the level.
Okay.
Okay, so I'm going to add a bit more. Try that. And let your body relax. Now, how are you feeling there?
Not used to this because I don't usually lay on my side, but I don't feel, much tension there. I feel a little bit of tension in my lower back right here.
Okay.
From that, I don't know if yeah.
So now, I know this is better than the last height was, though.
Right.
Because when I first put you on there, your eyelashes or your eyes, you're just kind of closed. And then open. And then closed. So it's not perfect yet.
Okay.
But it's closer. Okay. Now that might be too high or it might be too low. I'm not sure which. Okay. So I'm just going to put a different one in that's a little bit lower than that. And then just relax again. Let your body be loose. Now how are you feeling there?
That seems less pressure right here. Yeah, that feels pretty good.
Good. And just relax again. Now you notice your eyelids are almost closed right there. And you notice how things are, they're overall looser.
Yeah.
And you don't notice it as much.
Right.
Okay.
Yeah.
So I'm going to change your height just a little. Okay, lift your head. I'm just going to add a little bit here. Okay. How are you doing there?
Good. I didn't tell much difference between those two.
Okay. So that's fine. I'm going to do this little, just move your head down, just relaxing. I'm just going to kind of push on you a little bit, and that's pushing you forward, and that's pushing you back. Notice forward is a little bit stiffer than back. That means it's too high. So I'm going to put that down again. Good, and let your body just go loose again. And that's about the same both ways, isn't it?
Okay.
Yeah. All right, now. And just relax, that's fine. Now what we do there is I will lift your head for a sec, and I'm just going to put this underneath, and that gets you that little bit softer going on there. I'm going to just play around with the height a little bit more. Okay, lift your head, and
that feels pretty comfortable there.
Yeah. Yeah. Notice how your body your breathing slowed, your eyes almost closed.
Right.
If you didn't
I felt the some tightness that was in my hips when I did that last time.
Yeah, if you didn't talk to keep yourself awake, you probably would be asleep by now. Okay. So
the scenario is I've never slept on my side. How do I keep from rolling over on my back, which is the most natural position for me, and then that's real bad for me.
Yeah, the reason a person rolls backward is just because you're trying to get some stress off of the spine because you don't have your head in the right height. So if your head's in the right height, there's no tension on anything, all up and down, and so you'll fall asleep and wake up there in the same position, feeling real good and relaxed.
You won't roll. I won't try to roll on my back, even though that's been natural
Yeah.
position forever.
Unless there's something with your bed that's making you do that,
Well,
right? If your bed's a little soft,
Sure,
or,
sure.
or dip, or something
yeah,
like that.
where the bed is
Yeah.
naturally rolling you over. Okay.
Yeah. Now I know that you were like really interested in learning more about the mattress, and I'll talk to you about that.
Okay.
But I wanted you to know what this feels like when it's right.
Yeah, because I didn't come in with the expectations that I would be changing my sleep position, but I mean, this is very comfortable. I've never, maybe the reason I don't sleep on my side, because I sleep on such a thin pillow on my back. I mean, going on my side is not very comfortable with my head.
Well, that's good.
Dragging on the side there.
Right.
You can't sleep like that.
Yeah.
Yeah. And I've noticed that sometimes I'll roll over onto my side just because, sometimes you change positions.
Uh-huh.
And I'll wake up and I'll have pain in my upper back. And and now I know why. If my head's dragging down there,
Uh-huh.
I mean, I'm making this arc into my back, and it's putting pressure, probably not right on my neck, but probably, I think it's always about right here is where I feel it if I sleep on my side.
Right.
About right there, I wake up in the morning going, that doesn't feel very good.
Yeah, it makes sense, right?
Mm-hmm. It does make sense, yeah.
So, and that's what I find is most people end up sleeping on their stomach or on their backs because they've never had their head up high enough. In fact, most people will sleep on it below level, not even up to level. And as you see here, it's got to be above level.
Yeah, and at an angle.
And at an angle, yeah.
Because even if it was flat,
even if it was
flat, you're going to have some sort of kink
it
in
would
your
still
head.
kink there, right?
Yeah, you're going to kink in your neck instead.
Yeah.
Yeah.
So.
Interesting. Well, and as for firmness on those, that's really comfortable. I mean, for me, that doesn't seem overly firm.
Yeah. Now, you know what? That is probably the firmest mattress you'll ever be on. It's twice as firm as any firm mattress, okay, or even extra firm mattress. The foam we use on there, the foam we use on there is like 5 inches of a very, very dense